All right. So did everyone read at least one of the articles for this week? Okay. So I'll just summarize. So this week we're talking about non-drug approaches to psychiatry, which kind of contrasts from last week. We were talking about like psychedelics and how that can treat depression. And so this week we're looking at how dementia patients use music to treat depression, anxiety, and like anger disorders, and then how just exercising outside can be more effective than antidepressants. So does anyone have any thoughts to share to start off?
Well, music's processed in different parts of the brain than like a typical thing, right? So its ability to relationship between like memory and cognition is different than anything else. And like there's different forms of learning, there's different forms of memory. So the fact that like you can listen to a song from your childhood and it'll just take people who have a certain type of amnesia back to where they were, I think that's so cool. Definitely can access things that like you repressed, you know?
So this cognition thing, let's say, I have a personal knowledge of this. When somebody has a trauma to brain, right, and if they lost all senses, but when they come back, I remember this member of my family, when they came back, they could understand the language that they learned first in the childhood. And then they progressed. And they would understand that. They would start speaking. That's very interesting. The cognition is like a layer. It goes from step by step. See, right now, we cannot decipher at what age we learned this skill. Because it's all packet now, right? When you don't have any of those, you start from the same step. I don't know if that is true, because I did see that at least in the language. But when you're talking about cognitive ability, is this a progressive or is it a mass when somebody gets back the senses? Because I think it may have something that you're talking about. Childhood, if somebody is angry, right, and it's something, a lullaby, something that this child has heard, this person has heard this fun song, if that is good for anger management.
Yeah, and I think it's interesting because like we're looking at like anxiety and depression and confusion in dementia patients, and I think a lot of that stems from they can't remember anything, and then this music takes them back, and they can finally remember who they are. And
so I didn't have the opportunity, but just a quick question for the people that read. So is the experiment done in patients in what stage of dementia? Was it a specific stage? Is it like early or mixed, right?
Well, it was mostly patients who were like in an institution, so they were pretty far along.
They're pretty far in, but then they like segregated it more to like those who were more progressed in it versus like those in the beginning stages of when you go to intensive care for it.
Because I mean, I'm not like 100% familiar with how dementia works fully. I'm assuming you, as it progresses, you probably like forget like one thing or two, and then it keeps going. There's like different types of memory, like procedural memory, which is like remembering how to, do things, like how to eat, like stuff like that. And I think that's like the last thing to go, I'm assuming. So I guess what I was thinking is there any significant difference between like the patients that had just started to develop dementia? Did they address that, or is it kind of like the same for? Because I think it could be significant if there's like, a difference in like the outcomes.
The only thing I read was that they just saw improvements that were comparable to drugs that increased like the chance of death, and like so you're comparing like just making them listening to music from their childhood to a drug that literally makes them die sooner, and they give like similar effects.
Die sooner?
Yeah, so there's dementia drugs that it might help them like not be as confused or angry or depressed, but it makes them die sooner. But some people are willing to do that because why would you want to
Using it
live?
backwards.
You know, sometimes they don't want to live longer if they're going to be in this state of confusion.
Then how do they measure the anxiety level? The compare
Yeah, like most like psychological studies, it's surveys.
It's completely subjective.
yeah.
Well, I've heard that also, I've read somewhere that dementia drugs, a lot of them, they lower your heart rate too. So that obviously makes them like die sooner in a way, but it also like controls their anxiety. Like if they get angry normally and then they take the drug, they can just like, at a normal heart rate, they don't really have to like get angry or anything. Like the drug doesn't affect them. Yeah, basically. No, yeah.
Let me ask you a question. I think those who have studied neuro, when you're talking about Alzheimer's or dementia, is there, again, I'm going back to what kind of things do you forget? Do you forget your name? Do you forget your language of communication? Do you forget, motor skills? Sometimes people don't know what to do with it. That's what I heard in Alzheimer's, right?
Yeah.
But do they, what level of loss, what kind of things, when you say progressed, what is the initial loss?
It's
I'm being very naive here.
Yeah.
It probably is beyond.
It's kind of interesting because it's kind of like the things you lose first are almost the least important things.
Yeah.
So like an early stage dementia patient might forget their keys or like where they put their keys.
That would be
And then the
better.
last thing to go is like your basal like survival instincts and like your operations, like
how to
you were
breathe,
saying, how to
yeah.
eat and
Yeah.
like
you just
how to go to the bathroom.
because they just forget what they have to do, how to take care of themselves. They will need a caretaker to do those functions for them.
So that is after you progress.
That's after
Yeah.
you progress. So
So,
initially it is like
Normal forgetfulness can be branded.
not
I'm
necessarily.
just kidding.
So like I read somewhere that age is typically like blurred into the lines of like as you get older you actually forget things, but that's not true. You don't really forget it. Your ability to make those connections gets like older because like your body just doesn't function as it used to when you were younger. So you just deteriorate the connections, but your ability to make those connections is the same. So if you do the things to maintain your memory, you actively use your brain, whatever, still, I don't know, but you actively do things to continue your brain functions, it should slowly like reduce your chances of getting like dementia, which goes into Alzheimer's, which hopefully you don't die.
But it's interesting where physically, is there a physical location where this information is stored, where you can see that it is there, or it's just a concept?
So, I mean, I think I can answer this question because for the biological aspect of it, you can approach it a bunch of different ways. You can look at genetics. You can look at like one area that like I'm familiar with is that Alzheimer's is associated with the degradation of this
So
this very small structure called tubulin, microtubule, which
Right.
is in the cell, and it's a structure that allows for the cells to divide and for proteins to move.
yeah, it's transport within the neuron,
And
like for neurotransmitters to get to the axon terminal and so on.
And it
So-
also deals with the the plaques that happen with like with Alzheimer's patients. They notice these like beta amylose.
Yeah, there's like
A build up.
a
So it's the degeneration of those.
But I think it's like difficult when you look at those specific like aspects of it. It's difficult to say, oh, this is causing Alzheimer's or dementia, or this is like a side effect of it. I don't think there's a lot. There isn't like a way to like fully separate both. And about like memory, I think memory is like stored in like different areas of the brain. But I don't think I wouldn't know if it's more like something like higher level than like specific structures, which probably is more complicated.
Yeah, it's definitely like a heterogeneous disease or a condition. Like it's kind of like cancer, where it's like it's not like everyone gets the same cancer. Not everyone gets the same dementia. Alzheimer's is one kind of dementia, and even Alzheimer's can be broken up into a bunch of categories.
So that lends us that chemical intervention is probably the poorest way to treat it.
I think
Because
that's
chemical
true with a
intervention
lot of
goes
these.
to the site, specific site, right?
Yeah.
Because if you don't know what site it is, you are essentially damaging the brain by feeding these chemicals for a behavioral issue.
Right. It's kind of like a shotgun approach. And that's the same thing with like these SSRIs where it affects like the whole brain.
Right.
And then the other article we were talking about is like just exercise and going outside helps with depression, but that also helps with brain and memory and decreasing your long-term risk of Alzheimer's and dementia. So these are things that you can just do in your daily life that it's not a drug you take. It's just really you're trying to emulate the best conditions for your body to survive in. And like humans for all of evolutionary history had to be exercising outside, so our bodies are built to run properly in those conditions. And now all of a sudden we're inside, there's no sunlight, you don't have to exercise to survive. And we're seeing increased rates of dementias, we're seeing increased rates of depression.
So in somewhat sense, pharmaceuticals are just cop out from a proper therapy that is done right.
And a lot of these pharmaceuticals, they'll be good in the short term, but then your brain gets used to running with these chemicals, and it basically you go back to your resting state.
It gives like a reward, like if I don't know, correct me if I'm wrong, but if you take like an anti-anxiety, your body starts getting used to because you're not producing enough to like balance you. So now you've inputted this substance that's unnatural, it's foreign to your body. It gets used to it. It's like, give me more. I want it. Like I'm normal now. And then like it just completely takes you away, and then you get hooked. You like the reward. Makes you feel good.
And also, like biologically, their receptors, they also get if you're receiving more of like that specific chemical, your receptors kind of like grow more, so then you need even more to kind of like satisfy that. So then it throws into like I guess you just can't stop.
Right. It does less and less.
Tolerance.
Yeah. And then when you're off of it, you experience negative side effects. And that kind of turns out to be all that a lot of pharmaceuticals do in terms of like psychiatry. It's really just help you for a short term and then just upkeep your normal to the point where you have to take it to feel normal. And that normal still isn't a treated state. And so that's why we're looking at exercise and things that, I feel like for a long time we're kind of seen as, okay, whatever, the drugs are stronger, but.
And if we're talking about how like exercise and like just natural things are better, right, according to research and according to like a lot of data, why do you guys think that people they tend to like trust drugs more than like taking drugs or something?
The convenience of it, like we're so inherently lazy. Like God forbid I go on a walk, like I have to study, I don't have time for a walk, like I don't have time to go outside. So it's like the convenience of just like, well, I'm not gonna be hooked on it forever, right? That's what's going through your mind initially, and then you take it, but then you end up getting hooked on it, and the cycle's just so cyclical. It doesn't get out of it, it just keeps fighting its own tail.
And also I think because people trust science, or if it's like professionals, it's like, oh, research says, this study says, or like, oh, but my doctor said this.
No.
Yeah, I think doctors are a lot more eager to prescribe medication than they are to prescribe go outside for 30 minutes and do like 3 hours of cardio a week or something.
Sorry, no.
Okay. Also, I think, especially with like patients with dementia and Alzheimer's, they're probably of the elderly population, and I feel like a lot of people who are of the elderly population also may struggle with other things that are like preventing them from being physically active, like maybe they have some like, diabetes that are like affecting their ability to like walk. Like my grandmother has diabetes, and my grandfather also, and because they have like a lot of other diseases, other disorders, they're like very limited as to the types of exercise they can do. So then they're like, they're like forced to kind of do that. But I feel like music therapy would be good because you don't really have to be like super physical to really like engage in that. So I guess that is like beneficial.
Yeah, and I feel like on that front, I mean, the reason why they would take a pill rather than do music therapy is because I feel like just the sort of connotation of listening to music to get better kind of sounds like something a shrink would tell you. But now that we have research showing it might come
It is
more to the
printed
point.
now.
Right.
They say,
Right. They say exactly.
science says that music, heals Alzheimer's. Good.
Wait, I also wanted to add that a lot of like the trust, like the blind trust to like whatever a specialist says, and or like whatever farm company says. I think it's cultural as well. So my family's from Brazil, and the way that doctors practice medicine is more preventive. And here we felt like in the U.S. just because there's also issues with like how expensive it is. Like in Brazil, it's like universal healthcare, so it's more accessible to people. So they do a lot more of like preventive measures and do like preventive practice. After you have the problem, you go to the doctor, and then it's too late for you to prevent anything. So you have to treat it.
I feel like also people, because they don't go to the doctor, it gets worse. I used to be at an orthopedic clinic, and the amount of patients we would see who would have absolute, like, their hips are destroyed, but they're like in their 70s, technically, right? You got 30 years left, like, enjoy your life. And they've already signed themselves into a grave at that point. Like, God forbid I do a surgery, but you can't walk. No, I'm dying soon anyway. Like, might as well. Like, it's just, I don't know. I feel like there's just this lack of initiative to fix yourself because you prematurely see yourself die. We need to change the mentality that you can live and you should want to live. But if you think you're gonna die, like, why fix it? If that makes sense.
Well, I guess that also goes into the issue of like how's that person gonna go fix it if they don't have like health insurance and they can't afford it.
Yeah, that's true.
So it's like I think it's like a double-edged sword because you can tell people, hey, you should do this, but if they don't have the access to I think proper
But then I
care.
think that plays into the whole going outside, exercising, because those things you
Yeah.
don't necessarily have to pay for. You can just do it on your own.
Many people do
overlook
gardening.
that stuff.
Many people do gardening as a therapy. And it's also, extends life or mortality.
Yeah, I mean, going outside and exercising has wide-ranging benefits, not just depression, not just physical well-being, but pretty much every aspect of your life can be improved by physical activity and fresh air, vitamin D. I mean, we'll just have to discuss it another week, but vitamin D has impacts on basically any disorder you can think of. Vitamin D plays a role in preventing it. So.
I'm vitamin D deficient. I get it. It sucks. And I think like even more like I'm genetically predisposed because I'm South Asian, so like that kind of sucks that, it's genetic. And I didn't even know that I was vitamin D deficient until like a few years ago.
Yeah, and unfortunately, like supplementation really doesn't cut
No.
it.
Yeah.
Supplements don't help much. The natural ability to retain and use is better. More and more we end up spending time away from sunlight, away from outdoor activities, because we give ourselves a reason that, but I have other things to do. There are things I have to do indoors. So it just kind of gives us excuse to die sooner.
Yeah, I think it goes back to what you were saying earlier about not having time for it. Just people don't have time. I feel like here, like at least in general in the US, I feel like a lot of people they all have routines. They wake up early, they either go to work or they go to school, they have class. No, I don't have time for that, I don't have time for that. So they just keep pushing it aside and then they go to the doctor and they're like, well, it's okay, drink vitamin D, drink vitamin A, drink vitamin E. And then it's like, does that actually work? Does it not work? So.
I mean, the doctor, because he's dealing with bones, I mean, literally, first thing we need to ask these people, like, are you doing any physical activity? Like, not even if they're overweight or like if they have arthritis or they like broke something, like right away, the first thing to ask, do you work out? Like, do you exercise? Do you walk? Do you do anything to move your body? No, I just sit at my office job. I'm like, that's why you have an issue. Like, your bones aren't working. Like, they're bound to like fall apart. I mean, if you don't use it, any of you guys took AMP, like, if you don't use your stuff, it's not gonna work.
It won't work. Yeah. I used to drink coffee, like when I first started college. I used to never drink coffee, and I used to start drinking coffee like every day. And then I was like, I can't do this anymore. It started giving me headaches, and now I'm like allergic to coffee somehow. And I replaced it, and I try to, not every day, I will say, but at least out of 7 days a week, I try to wake up earlier. My classes are usually like 8:45 or 9. I wake up early and I just go to the gym for 30 minutes. I don't do much. All I do is treadmill. I don't know how to do anything else. But I will say the days that I don't go, I am so tired by 2 p.m.
Yeah.
So I guess like it's just like, and I don't drink coffee anymore, rarely. But I will say exercising does help. And I just go for 30 minutes. I don't have time to go for any longer. But I just set my timer 35 minutes and I'm just walking at a high pace. And I will say it gives me a lot of energy.
Yeah, the human body is pretty paradoxical in that, like, when you use energy, you kind of gain energy. When you, like, use your body, it's like the only machine that the more you use it, the stronger it becomes. Like, pretty much every machine we make, the more you use it, it degrades.
Yes,
But our bodies, if you use it, it becomes better. And it's important to say that it's not just your muscles, it's not just your heart, it's your brain too. It increases blood flow and oxygenation and everything.
Yeah, it produces I think it's endorphins, and that's what like relieves anxiety and stress, and like just helps you set for the rest of the day, whether you do it at night or in the morning. So that's
So what are the other things that they're suggesting? What are they saying about this research that you're talking about? Is it music and outdoor activities?
So there was 2 different articles we were looking at. One is music therapy in dementia patients, and then the other one is indoor physical activity versus outdoor physical activity versus no physical activity. And even the indoor was supplemented with vitamin D. And they saw basically the same statistics you get from the psilocybin mushroom treatment, where it's a 50% decrease in depressive symptoms. And both of them are 4 times more effective than our standard SSRIs. So take mushrooms and go outside, and
that's the marker for 2 weeks together.
That's what our modern science is telling us to do for depression.
So music didn't help much?
Oh, the music was for the dementia patients,
and
yeah, that's for the dementia patients, and that does help them with their depression, their anxiety, their confusion, and everything. But yeah, I mean, I think there's something to be said, right? I mean, you take these natural plants or funguses and you go outside and exercise. This is all things that our ancestors were surely doing. And I mean, we shouldn't 100% replicate our ancestral environment, but we're definitely, I think, in my mind, way too far off currently.
I think with the mushrooms, I don't know about you guys, I wasn't here, so I'm unfamiliar with the study, but watched a toxicology video, and they said not to eat any mushroom you find randomly.
No.
No,
that you randomly find, don't take it.
Yeah. Yeah.
Just
Taking one out of the grass.
And apparently, I don't know, I think I'm remembering correctly, they give off sounds. Like mushrooms can like produce music. I don't know if you guys have heard of that. I'll find it.
I've seen that. I don't think I really buy it.
Mushroom music. No, like they give off certain frequencies. And then also they have certain dyes, like if you put them on a piece of paper and you just just let it chill, it'll release a dye onto that paper. That is so mushrooms are cool. They're really fun dyes.
Wait, but the mushroom, it was last week, right? Was the way that they measured depression, does it like through a survey as well?
They did a survey, and then they also did fMRI.
Oh, okay. And on this, the one from today, they did not do that. They just
I did not see
Well, it
fMRI.
said that it activated different parts of the brain that are also activated with like cocaine and stuff, like rewarding centers.
Mhm.
So I mean.
Yeah, for the music therapy.
Yeah, for the music therapy stuff.
I did find it. It's a pink oyster mushroom.
I've eaten those. They're pretty tasty.
I don't know if it's really therapy, but it does release certain frequencies that like sound. I think that's pretty wild.
Yeah, they're plugging electrodes into the mushroom, and they're like modulating it with some sort of computer program to make it sound
Right.
like something.
Can I imagine that a mushroom is singing?
I mean, mushrooms are really cool. They digest outside of their bodies, and they're basically nature's chemists. They excrete these enzymes into the soil to digest things outside of their body.
I believe if you track microscopic effects of plants germination or leaves growing or buds, flowers opening up, each of these have certain, noise, certain sound they make, and it can be, as I said, augmented into music, if you must say. Because without noise, nothing is going to happen because the air has to be moved when something is growing. So there may be some noise that is caused because of that. And the structure of mushrooms is such that the displacement of air has certain unique frequency, I guess. That sounds scientific?
I know rain helps some people sleep at night. But like hearing rain music, it makes them sleep at night. Yeah. The waves, yeah, like waterfalls.
Yeah, I think it's like to the point some people have those like apps on their phone that make the noises rather than just like living in areas where they can hear it. I think that's
Like the white box. Like the
yeah,
white noise.
yeah, like white noise.
I can call it white noise. That was a weird discovery.
Yeah, I wonder what's like the neurological basis of that. Like, if that can also treat disorders, or if it's just simply like a relaxing thing. Which I mean, that in itself, right, can treat anxiety potentially. Instead of like popping a Xanax, you just turn on the whale noises.
Do you think it's more of like an association with sleep to like that's their noise? Like some people literally listen to like the rain before they go to sleep, so they associate rain with sleep. Right?
Yeah.
I always thought of
that's
it.
good.
I always thought of it as like, if you're in a silent room, you're going to notice every little noise and then you're going to focus your attention on that. Whereas like the white noise basically tells your brain that anything coming into your ears is basically nonsense and you just block out that sense. So you're not going to hear like
It
the,
helps you focus better.
yeah, you're not going to hear like your roommate doing dishes or something. You know?
Wait, what's your name? Yeah, so you said that one of the papers showed compared the music with like a specific place where like cocaine, like where people use cocaine on that.
Yeah, I activated the reward centers that are also activated upon cocaine users, I think.
Yeah, about that, I think that's like super interesting because a few semesters back I took a class. It was called like Intro to Consciousness, and it was like a seminar where we just talked about like our perceptions of ourselves and stuff, and why do we think we're real, and all this stuff. So then we got to read a lot of like cool papers, and one of them was about like how music, people listening to music and having the experience of like music is similar to like hallucinogenics and stuff like that, which I thought was cool. I was like, I don't know why.
I just left 113. I was just cleaning the glove box.
Okay. Well, we're talking about non-drug approaches to psychiatry. Did you read any of the stuff?
My whole
Okay.
humans,
I mean,
feel like we're
okay,
all just
what?
very conditionable, whether it's operant or very like conditioning, because we are like inherently we have these sort of behaviors that like are innate to us. We want to feel good, and that's understandable. We want to minimize pain. There are certain like things that our ancestors did, and like whether it's the reward pathway or anything, like we just want to satisfy that need. So we'll do anything, and if we're trained to do it, it amplifies it even more. Because, I mean, the situation where you do something completely controls it, like whether you're going to do it again. Like all different memory pathways, like you study in a room, like you memorize like the whole walking around the house, you associate different things. That's behavior. That's like conditioning yourself, like to associating different things with certain things. You're activating your reward pathway. I'm sorry, a little rant, but
mean, in that case, you can train yourself to be any way that you want to be. Like by familiarizing yourself with whatever. Like if you change your environment and you want to live in a different way, you can do it. It's actually gonna
Your routine.
Yeah.
Like I understand why, I guess associating like one thing with another thing is like important, and why can you like pick that up? Like why specifically like music? Why is that the thing that makes people feel happy? Like I know like I can say, oh yeah, I like to listen to music. I can't explain why.
Yeah.
Or why it was beneficial to like do that. Because I'm assuming people have done that for centuries. If you could do things for centuries, you could just do it for like survival or whatever. But then it's like why?
Yeah. I mean, I think for me, like music, I sing. So it's like, and I've done that my whole life. So it's kind of always been a part of my life. So I think what we're talking about, like, you know, it's kind of like a routine. And I think like music therapy, I've never done it before. I don't really know exactly how it works, but like, because I listen to music on my own a lot and I listen to like different genres, I find that it helps me personally, but I think it's different based on each person, you know?
Yeah. Do you want to pose a question, everyone? Who plays an instrument? Okay, what instrument do you guys play?
Piano.
I kind of, yeah. Not really.
Fair enough.
Violin.
Julian,
No.
do you play an instrument?
Yeah, I play guitar.
So they did studies that showed, that if you know how to play an instrument, your language acquisition skills and ability to be like bilingual, trilingual goes up through the roof. So there's a huge like association with you maintaining languages, being able to speak it and like learning it. Because you know, like when you hit like 20 or something, your ability to learn a new language is far more challenging than trying to learn it when you're like 4 or something. That is just so cool that like language and music incorporation just they're intertwined and they blend so well. And like if you know one instrument, you can just pick up another, like snap them in it. Like just do it out of that.
Yeah, I think that's interesting, and also at the same time, like when you think about it, it's kind of logical because they're both like ways to encode thoughts, right?
Exactly.
Because like music, it's a string of sounds, right? Just like language, and it portrays certain emotions and messages, even if there's no words attached to it.
Exactly.
And I think it's also like a shame that we're not looking at this music therapy stuff until now, because I think we all inherently know the great psychological impacts that music has on us. Like, we don't perceive it as a drug, I don't think, in our society, but I think it certainly should be seen that way.
It definitely functions like one. Like,
Yeah.
you know,
Well, what is a drug?
something that
Well,
makes you feel different.
Right?
It's traditionally a chemical that impacts your
So you are doing a
mind.
hatchet approach, while you could have done a non-hatchet approach to get the same result.
Yeah, and it works in synergy with the mind instead of, like you said, hatcheting and just like forcing a chemical into the mind. It's basically working with the mind and your perception.
Have you,
Ultimate.
I'm so sorry.
No, go ahead.
Have you guys heard of Tony Bennett, Lady Gaga, any of that?
Hmm.
So he has Alzheimer's. He's very progressed in his Alzheimer's stage. He's still able to perform music as if how he did when he was in his prime.
Right.
He's still able to sing on cue, and he still knows all the words. And so, and Lady Gaga did like an interview on this, and she said, I have to gracefully approach him because he doesn't know who I am.
Right.
So, but they have music together, and they went on tour together, they have songs together. And she says hi, like she just, like as if they don't know each other. And they sing together, and he knows the song lyrics with her in it. And that is just, everyone is so understanding and respectful. And he's like also in his late 90s or something along those lines,
Yep.
mid-90s.
Yikes. Probably because it's different memory, like procedural memory, some memories. How to sing.
Yeah. Just not people anymore. He can recognize his songs. And it's just all different coding in the brain and knowing where things are. That's just,
Model, do you know, is procedural memory like more hardwired?
Yeah, like so like it becomes subconscious. So like you know how to ride a bike, you're like not to forget it even after 10 years. So
That's interesting.
Yeah, different things can become procedural if you do that enough.
Yeah.
Like math can become procedural.
Playing an instrument.
Play an instrument, and things like that. And another thing, I also heard like a story of like a famous musician, I don't remember his name, where he played the piano and then he stopped for like many years, and he trained in his mind to imagine him playing. So then after many years, like he stopped, he did it again, it was like perfect, as if he never like had stopped, and people were like, how that happens, like, well, so like that makes sense, because like everything goes through.
It's just super great.
First.
Yeah. No, I completely agree with that.
Our minds is really powerful. It's kind of scary, but like it's really cool.
I feel like going back to your thing about like learning multiple languages and being related to like instruments and stuff, like that makes so much sense because when I was younger, I used to be able to play like 5 instruments. Like I learned piano, then I learned violin, then I learned guitar. Like I don't know what was up with me. Like I was so obsessed with it. And then like a few years later, I ended up like having to stay with my grandparents because they were ill, and I was like, oh, I'll go stay with them for the summer, and they don't speak English, so I had to like learn the language they spoke. And I picked it up in like weeks, and I'm fluent, and I almost see them every break even now. But like I don't even talk that I don't speak that language with my father, who's the only one in my family who speaks that language. But when I go there, like it just comes back. And then I'm perfectly fluent again. And then it's like, I don't know, but it's weird. And I feel like maybe the fact that I did so much like musical training when I was younger, like might have helped me pick up languages when I got older.
No, I'm in the same boat. I learned piano when I was really young and speak multiple languages. I only speak certain languages with my grandparents and not with others, but completely switches off.
Yeah.
Even though like I'm not in that mode, not actively doing it.
It's true. And I feel that same feeling when I play piano because like I don't really read music. I like learn it by ear. But like I don't think about playing a G and playing an A. Like I just play. Like I feel like it's like a subconscious type of thing, but it's like the same way that I just speak the language. Like I just play the piano. So I guess that's interesting. Probably as you said, connections.
So since it seems like we've been talking about music and like psychiatric disorders, I don't know like if you've been in the stairwell, like obviously we've all been inside this building, but if you've been in the stairwell, the audiology department of NSU, the PhD school, they were doing research, and I actually went and they did a whole bunch of stuff, and they actually were looking at so they bought a new machine, and it's like electrodes on your forehead, and then you sit there for an hour, and then they like play the noises in your brain. Like you don't hear it. like that's the only way I could describe it. It was a really dark room. I sat there and I had like probes in my head, and I was like, okay. And like they play, I guess, different frequencies and try and measure your electroconductivity between the brains. And then they did like the traditional like, do you hear it? Raise your hand. When you were a kid, if you remember that. And I found it was interesting because one of the questions they asked is like, do you have any major psychiatric disorders? So it seems like there's a link between like how well you could hear and how you're perceiving the things around you. And I guess that's what the audiology clinic was looking at. I don't know. I was just their test subject, but I found it really interesting that they were like super hard on like if you like, okay, do you have depression or anxiety, like very specific. So I don't know. I haven't read any studies that had ever connected the two, but it looks like the schools trying to connect the two, whether like if you could hear certain noises or certain deficits make you like less inclined to listen to people and type of stuff. So very interesting.
So you can essentially assess a person's hearing ability and make some kind of connection to the mental state.
Yeah, I think that's what it seemed like what they were doing. I mean, I was just a research participant, so I was just like listening, but from like how they were building the study, it was like the new method, with the electrodes and bypassing like the hearing canal.
I see.
And then I guess they were trying to connect that with like the data from the old school, different frequencies, can you hear it left, right? And then they also did, kind of a little more anatomically, they put pressure in your ear and then way worse than the other. Headphones are detrimental. That's all I have to say.
In the engineering lab, like in the room right over there.
Oh yeah, I've seen a couple people.
They have I just learned about this today. I don't know what it's called. It starts with an S, but it's like a hat. It's like a cloth thing that you put over your head, and it measures your brain waves based on how you feel. So I thought that was pretty cool. My professor was like, so we can see like what your waves are like when you're sad, when you're happy, when you're angry, and then compare them. I think he's doing like research into yoga and how it affects you and like your mental health. So
Interesting. Yeah, when if you guys remember, like our freshman year, we did like that UNIV class, right? And you got to visit other parts of the schools as part of assignments. I went to the College of Psychology because I was like, okay, aside from chemistry, psychology is what I like next, right? And it was really cool. What we did is we like shocked each other's nerves, which I thought that was very interesting. We put electrodes like along one arm. Did you do that too?
yeah,
Yeah, you put your electrode in your arm and then you squeeze your wrist, and I guess the electrical impulse, it goes through a machine, and then the other person attached to the other end flings their arm. Yeah, it was super fun. It was scary, but it was super fun. So I'd like squeeze my wrist and someone else would move, and so it's interesting how the electrical, physical, and chemistry side of all this really influences like our biology, and like I have yet to meet a psychiatrist that can like define sadness in a good way. They're like, what is sadness? They're like, depends who you are. They're like, for some people, like it shows up in different ways, and like even biologically, the cortisol levels, like all those things that people talk about, there isn't like a real number. Like, 100 milligrams of cortisol for me, I could handle maybe, and then it might make someone else go into a heart attack. So I also find that very interesting. Like, the actual chemical aspect of psychiatry kind of doesn't matter, but does. I don't know. I guess more research is needed.
There's also a lot of variation if you look at gender, and which is like interesting because most of science has been done like looking at men and men's bodies and their metabolism, which is very different from women, and like using male mice. There aren't that many, unless it's like a gender study, seeing like differences between women and like X disease. There aren't that much like research on like women in general, historically, and now.
Well, the study of feelings in mice cannot be associated with feeling in humans.
Yeah.
You can, just like a taste, what taste to cat is not same thing as a taste to humans. So sweet or bitter, the feelings also probably are not transferable between species of animals. So research is limited. So other diseases you can make a connection. The fever or infections, you can make connections between animals, but between these feelings are difficult to.
Arbitrarily, right, 1,000 people to define, and then they can isolate, like, okay, well, why are they saying out of a scale of 1 to 10, they're like an 11, like, what's going on with them? And then we could pull them aside and then give a different survey to that particular demographic and like say, okay, like, you said you're an 11 out of 10, like, what's going on, what's your definition of sad? And then, like, you can further understand, right, just completely delving into it. I don't know, does that make sense?
Are they doing that? I hope.
That would be great.
Good question.
I'm not sure.
Wouldn't that be mostly effective if it's like for extreme cases? Because if you're like in the middle, it's like.
Well, yeah, like at that point, it's very. I mean, it is subjective. It's an emotion. Like what might be sad to me is like bunnies and cake for someone else. So, if you say you're a 5, okay, well then let's subcategorize you, give it a range. We'll test you here. Let's arbitrarily say 3 to 6. That's the middle range. You bubble. That's how sad you are. Okay. Does car accidents make you sad? Do bunnies make like just weird questions to further subdivide? I don't know. I maybe that's just my own philosophy of it. That's probably what would get the most amount of, correct responses, and then you'd be able to assign a number to that subjectivity.
Yeah, I feel like the subjectivity is all that matters. Like, doesn't matter if it's necessarily, because there's no objective trauma, right? It's all, or objective sadness or objective anything.
I think there is. I think there is some some universal thing that all of us would agree upon is sad.
Maybe all of us in this room would agree upon it, but maybe someone else would disagree.
But then it's
Because subjective experience is subjective, fundamentally. Like,
completely agree, but wouldn't everyone agree that if they lost someone in a car accident who they dearly love, that would make them sad? I think that's a collective agreement, and we could make that an objective statement.
I think people in their right mind would say that, but not everyone's in their right mind.
Somebody they love.
You put that in the lines, like someone you love, because then I feel like we would all agree, like, yeah, if you don't like someone and they go in a car accident, maybe some sick part of me is going to be like, yeah, you know how they're going to respond. But if it's someone you love, I think at that point that subjectivity becomes objective.
But I think that for things like that, you might say yes because it's socially like acceptable, but you might not like that might not be your reaction.
What if your loved one is terminally ill and gonna suffer, and it's basically like a euthanasia? Or what if you're just crazy? What if you're just crazy, right? And maybe we think of a crazy person as crazy, but they themselves think of themselves as perfectly sane.
I guess. I mean, I don't know.
There is no way to objectify trauma or emotion.
I think surgeons are legal psychopaths, but to each their own. I could never cut somebody up and watch all the blood and guts come out and be like, okay, I'm happy with myself. But they are. They're like, I helped somebody. But they're good people, right?
If you're helping someone.
What is help?
But it's so interesting that every time you look at the television, say, how do you feel now that you have lost your loved one? Feels like a ton of bricks fell on me. Hey, when was the last time a ton of bricks fell on you? Was that real feeling? Did a train hit you or bus hit you? When did that happen? When did that happen to say that it felt like a bus hit me? When was the last time that happened? So how do you quantify that? Because these are, euphemistic ways of exaggerating our feelings, right? Sadness or happiness, ecstasy and all that. Because you just I feel like I'm in heaven. When was the last time to express that?
Checkmate.
I think it's interesting that we consider a lot of pain with the feeling of pressure and weight. And I find that a little bit interesting just because it's something that, now that you mentioned it, that I guess in a lot of cultures, they kind of use that, weight, gravity, force on you type of expression to, express stress. And I wonder if it's because, what happens when you stress out? Your heart starts beating, you get sweaty, you freak out. I'm I wonder if that's our own response to our heart rate going up and all that. And it's I feel pressure, I'm getting blown up, literally. But, with your blood.
Do you think that numbness is a type of sadness?
Yes. Why not?
Because I was thinking the same question about if somebody you love that died in a car accident. Because what if somebody has been through so much trauma and sadness that they're just no.
They don't feel anything.
That's a good question because when we were talking about the SSRIs, those just make you numb. They don't, it's the absence of emotion rather than the presence of negative emotion. And it seems like we would rather be numb than sad, but not me.
I think it also depends on the SSRI as well. Because there's some over the counter, you know that? Like GABA. Those are over the counter. You could buy them at Walmart. So I'm okay, what are we doing with these SSRIs?
Or is it so far beyond your feeling level that you don't know what to do with it?
Sort of beyond perception.
It's beyond. Now you don't know that there is a spectrum at which you cry or you feel sad. When it's gone beyond that, you have no idea what to do. So it's kind of numb. No response.
Could that also be argued as denial?
Defiant, yeah.
Because you don't know what to feel. I feel like you're mentally sorting what's happening, and you're just trying to come to terms with it. Because if someone dies, right? But let's say they weren't sick, they're healthy, they're young, and all of a sudden, randomly they die. you don't know, like, wait, what?
What feelings are acceptable?
Yeah, you don't know, like, okay, were they in, like, a car accident? Like, did they not feel anything? Okay, well, great, then, like, they didn't feel anything, but, like, what? I've never seen them. There's just so many conflicting, contradicting, and it's, like, emotions and thoughts that are just, you can't process at the moment, and that if someone asks, you'll just, like, vomit, like, so many.
Standstill.
Yeah, and then
Hidden,
you
yeah.
get to a point where you deal with the numbness. I feel like it's a temporary state.
I think it would be, yeah, I mean, I don't know, actually. I'm pretty sure, I mean, numbness is probably a created state, like maybe over time, like depending on how much trauma the person experienced or something, but I feel like, I don't know, I feel like you would still feel something, you know, like no matter like how, like maybe it could be like a preface to like something that you have, I don't know.
I think that also goes back to like what we're talking about how it's, in my opinion, it's impossible to subjectively or objectively assess something that it's inherently subjective and relies on people like communicating what's going on with them without like assessing in in even a biological way. I think it's very, very difficult because like we all know, for instance, about like memory repression, when something really bad happens to you and you repress the memory and you're not aware of that. I don't think there's a way to like explain. You can try to like research that and all that stuff, and there are theories about like the subconscious mind, but there's no way to like prove it, and I don't think people even know how to like objectively prove the existence of like something other than like our like awareness. So I think that's interesting.
All right. Does anyone have any final thoughts? All right.
You guys want to discuss, look into for next week? Do we prematurely know, or should we just wait it out and discuss in the group chat and vote on something? What do you guys want?
Yeah, I think just give us some time and whatever. If you guys have something you want to send that you want to discuss, go ahead and we'll vote on it. But otherwise, thank you everyone for coming. This is a great discussion. Hope to see you next week.